have Senator Hewitt here today, who is the author of the legislation that helped to create this committee. It didn't take her long after she got here to realize that 1/3 of our entire budget, both federal and state, happens to deal with Medicaid. And so with that larger portion of the budget and the numbers of what we spend in that area change, well, they change dramatically sometimes, and sometimes she thought, and we agreed wholeheartedly, I think unanimously, that we probably needed to have this conference committee just like we have revenue estimating, so that we can kind of have a public debate on what we expect to spend and why those numbers may change during time. So.
Well, thank you, Mr. Chairman, very much for giving me the opportunity to talk about this. It became very clear to me during 19 weeks of session that if the state does not manage our health care budget well, we're going to be in trouble. It is about 45% of the state's budget, and it is the single biggest elephant in the room. And the fact that we're going through Medicaid expansion with the uncertainty surrounding that makes this committee, I believe, one of the most important committees that will be working in the state capitol. So the vision is similar to the revenue estimating conference, whereby they are looking at, forecasting revenues, coming into the state, so that we could, as a state, make adjustments as we need to in terms of our expenditures. Okay, likewise, it became clear to me as I was sitting where you are and hearing testimony at the table that lots of different smart people could have different opinions on the rate of Medicaid expansion, the types of services that will be utilized, the cost of those services, etc., that smart people could agree to disagree, and that yet we were going to put a number into the state budget. And so I think my vision is for us to have the healthy discussion and to put experts like yourselves together in a room to be able to debate these important things, because when you're looking at a $12 billion budget and you're off by 1%, you're talking about $120 million. It's a big number. So everything that has to do with LDH is a big number. And so those details matter, and they're going to be really important. And you all, in my view, and in the view of those who appointed you, are the experts that can help us have that healthy discussion so that we can put together what we believe is the very best forecast into the state budget and manage it periodically during the year at critical points so that we can adjust as we need to. And then in the bill, I formed a Medicaid subcommittee, which is where I think most of the uncertainty is and where my interest is in helping, with the forecasting of that effort. So the vision of how this would work would be the Medicaid subcommittee, which is largely the professional staff and the real number crunchers would work offline, to develop forecasting numbers at critical points during the budget process. And those areas, as you all know probably better than I do, are, let's say now in September, to help develop an initial forecast which would be used by LDH in formulating your budget request for the upcoming year. And then in December, again, to revise the forecast for the upcoming year that would be utilized in preparation of the executive budget recommendations by the State Budget Office. And then in April, to look at the forecast again as the legislature is looking at adopting the budget. And then in July, to discuss the forecast for the current year as compared to the current year appropriation.
I mean, it's fair to say it works similarly much like the Revenue Estimating Committee, except, of course, you're not estimating revenue, you'd be estimating expenditures.
Healthcare expenditures, exactly.